This morning, I am delighted and honored to be joined by Ike Anya. Ike is a veteran public health expert. He is the founder and co-founder of Nigeria Health Watch and Epi Africa Consulting, and therefore has an enormous amount of expertise about public health issues, particularly in the African continent and the global south. But is also based here in the UK, and so I'm really delighted. On a personal note, we met almost a decade ago as TED Fellows in the first TED Africa, and reunited at the Conduit, where Ike is a member. And I wish we were having a call in slightly happier and less traumatic times, and I'm sure we will have more of these in happier and less traumatic times. But it is nevertheless really wonderful to see you, my friend.
Well, thank you very much, Paul. Thank you for the invitation. And yes, I hear you on the less traumatic times, but these are the times we live in, and we've got to deal with them as best we can.
Exactly. So let's start in the UK. We've obviously had two quite tough days in a row, where we've seen the mortality rate, which is in some ways the truest specific indicator of the nature of the crisis, double and then go up another 50% on top of that. So we're post 500 daily deaths. And so the UK is beginning to look quite a lot like Spain and Italy in terms of the way that the pandemic is moving its way through our society. And we see this morning examples or stories of London hospitals on the verge of running out of oxygen. So we're in the grips of it, and I think the next week or so will be difficult. And on earlier times, in earlier conversations in this series, we've allowed ourselves flashes of optimism as it looked as though the numbers were staying sub 200. And I think there are grounds for us now to be a good deal less optimistic in terms of how this is going. So tell us, your perspective, where you see things going over the next couple of days, and just a little bit of the kind of big picture of what you're seeing in the UK in particular.
Thanks, Paul. I think that in relation to, I think the first thing I need to say, as someone who's worked in public health for a long time and in outbreaks, is that we've got to take the long view. The day-to-day developments are important, but it's important to remember, given the incubation period, given how long it takes for things to work out through the system, that the actual changes in numbers from day to day, while significant, and also the developments that happen day to day, while they are significant, they need to be sort of positioned within that context. So I'd like to say that. I'd also like to add that, outbreak management is a crisis mode. And what that means is that it's a very delicate and complex process where you're constantly having to make rapid decisions under a lot of pressure with imperfect information, a situation that's completely changing all the time, and lots of competing interests, as we've obviously seen with this. So in terms of where the UK is at the moment, I think, I sort of want to go back to the fundamentals, in the sense that what you want is a strong, in an outbreak situation, is a strong leadership that's taking advice from the experts and is trying to put that advice into practice. So I think there will be the continuing challenges about making sure that hospitals have what they need. There is a ramping up. Certainly, talking to colleagues around London, I know that over the last week, there's been a massive ramping up. I've heard fellow consultants in other specialties saying all their registrars have been pulled back to work entirely on COVID wards. And, obviously there's the opening of the new hospital that's come into play. There's attempts to increase the amount of testing. So I think over the next couple of days, I think we should also brace ourselves, and people have said this right from the beginning. And I experienced this sort of in a quite personal way yesterday when one of the doctors who died was someone who was an inspiration to me, a British Nigerian doctor, Dr. Sadu. As his son said on the BBC today, people will die as Boris Johnson said, and as the WHO have said. And I think it's important for us to remember that, that this could get quite bad, but that doesn't necessarily, what happens on a day-to-day basis doesn't necessarily indicate what's happening. And I want to sort of look at, I think looking at the newspapers and the news today and all the recrimination about what's got behind, I'm thinking this isn't what you want in an outbreak situation. You want to look ahead, you want to look forward. There's time for a debrief and an evaluation of what went right and what went wrong, but this isn't the time.
So let's talk then about testing. I don't often cite the front page of the Daily Mail for anything, but yesterday, or maybe today, there's a reference, a comparison between the testing that's happening in the UK and Germany. And basically, it said the Germans are testing about 100,000 people a day. The UK is struggling to test 8,000 people a day. And in their typically colorful language, they said that's like testing an entire FA Cup final at the same time versus a home game for Peterborough. And so leave aside, again, judgments about, what the UK is demonstrably getting wrong.
Mm-hmm.
I think the question is more, if we're trying to manage the outbreak and if we're trying to allocate resources wisely and if we're trying to do some modicum of contact tracing, it's very, very hard to do that when you're testing at the level that the UK is, or have I got that wrong?
I think, you see, on testing, I'm slightly in the minority school of thought on the question of testing, and it's something I've also talked about in Nigeria. Of course, in Nigeria, the challenges are different in terms of resourcing, but my point is, if everyone assumes who has symptoms that they do have COVID and behave in that way, i.e. self-isolate strictly, I think that's actually a better use of resources. Yes, there's a place for contact tracing and testing, but given the pressures, whether it's logistic or actual resourcing of the tests that we have, it's about using those tests in the most targeted way. And so, yes, obviously, the UK should be testing much more, and I think everyone recognizes that, especially at this point where there is a lockdown. You want to make maximum use of that window of opportunity. But the other thing to say is, everyone is saying this country got it right, that country got it right. That's standard in an outbreak. As I said, people are making decisions with imperfect information against different competing priorities, and inevitably different decisions will be made in different places. And we will not really be in a position to say who got it right or who got it wrong until probably a couple of years on, when we can really look back at what's happened. And that's, there will be the daily debriefs that happen every day, and people looking back at what's happened and constantly tweaking their strategy as a result. So I think there should be an expansion of testing, but I think there's also there needs to be a wider understanding of the limitations of testing, because I think it also creates an expectation in patients, certainly in Nigeria, and I think to some extent in the UK. I saw this on social media, where people are saying, well, I've been ringing trying to get a test, I've got the symptoms, and I've been ringing trying to get a test, and I can't get it. And I'm thinking, but why do you need a test, actually? Apart from the epidemiological reasons for public health to want to keep a handle on it, at an individual level, if you've got a cough or a persistent fever, or those symptoms that, we've been told, just assume that it's COVID, and, don't chase a test. In relation to the epidemiological side, what people also don't talk about, and I don't know to what extent this is being deployed, is that you can also, there are also sort of sampling methods and various other statistical ways of keeping a handle on what's developing without actually testing every single person. Because that's the scale of the challenge.
So let me pivot and ask you a question, as a way of talking about particularly the outbreak in Africa, which, I think some ways gets swept under the carpet, and in some ways understandable, because people talk about where the crisis is closest, but I think just the sheer numbers and the scale of the magnitude, the scale of the challenge requires us, from just a human level, to look particularly in the global south and in Africa. If there's a ray of light, yesterday, a controlled trial out of China indicated, very small group, but indicated that some anti-malarial medications led to statistically significant improvements in a group of people who were mild to moderately ill, not deployed on people who were critically ill, but on that control group, some quite statistically encouraging results. So are you hearing that? I mean, particularly you've done work on the malaria front in Africa. It would be interesting if anti-malarial drug came and was at least part of a treatment regime that could make a significant difference.
Yeah, no, I mean, it's interesting. Like chloroquine, which is more or less a banned word. I mean, growing up, chloroquine was what every young African had when you had malaria. Terribly bitter, horrible side effects in terms of making you feel horrible. But that was the main thing that was used against malaria. But then resistance developed, and so over the last 20 years, we've moved away from it. And in fact, in many ways, it's kind of almost become a pariah. And so it's interesting to see some of these early results and some of these speculations. I think it's very important for us to be clear about what the evidence says and how limited that is, and not leap on the nearest thing, because I think we've seen certainly with President Trump talking about chloroquine way back early, and we saw incidents of people overdosing on chloroquine in Nigeria as a result of having rushed out to take lots of chloroquine. So I think as perhaps, yes, certainly an interesting one to watch. It's interesting to learn that some people are pushing, and I'm involved in groups where this is part of the debate, that some African countries should just go ahead and start rolling it out, limited as it is, given the scale of the challenge they face and the fact that there's very little else in the armory to fight against this thing. And there are some suggestions like Kenya might be rolling that out on a national basis fairly soon. I have no idea whether that's true or not, but certainly I think, yes, that's something to explore. I think it highlights something that's also important about the pandemic, the need to understand that different places are in different countries and different regions are in different places in relation to this, and they need to tailor the response while following the same principles, but tailoring it to the context of what's available. And I think that's where, in some ways, I'm quite pleased at where Africa, cautiously pleased at where Africa is, in the sense that in the last 5 years, there have been developments since the Ebola crisis that mean we have very competent Africans who are operating at a global standard, in charge of organizations like the Africa Center for Disease Control, which didn't exist 5 years ago. The Nigeria Center for Disease Control, which is being run at the moment by my friend and brother, who you also know, Chikwe, who was a TED fellow with us. He's there, and obviously against a lot of challenges, he's trying to do his best. But I think that's one of the things that we need to think about, what is useful in what context. If we're not going to be able to afford or get the numbers of PPE that our doctors and nurses need, what are the alternatives? What can we get to them quickly that will do the job? If people are saying I've seen lots of criticisms of social distancing in overcrowded areas, in slums, or having lockdowns where people have, I'd also like to see anthropologists trying to understand what are the alternatives, and epidemiologists working together saying, what are the alternatives to this, given that we are in overcrowded situations and we need to keep people apart and this virus spreading.
So what do you think? I mean, give us a practical sense of what's happening in you could say, place extremely well, Nigeria. Give us a sense of the, on the ground, where you
Yeah.
think the trajectory is going, how well officials are responding. Give us a sort of textured sense of what it looks like in Nigeria right now.
Yes, so in Nigeria, I think we have about under 100 infections or just about that, and 2, perhaps 3 deaths so far. Very much looking like it's following some of the patterns that we've seen in other parts of the world. There has been some hope that given that Africa's demographics, we have much, a much younger population generally, and the virus seems to attack sort of with more serious complications, people at the other end of the age spectrum. But at the moment, that doesn't yet seem to be feeding out. In terms of the response, obviously hugely, hugely challenging in terms of what is being done, the scale of what needs to be done. But like I said, we're particularly fortunate at this time to have some key people in position who have tried to put in place things. So the response, there's a lot of impatience in the public about, again, like in the UK, about why aren't we doing more testing, and why aren't we doing what this country or that country is doing. But I think that what we do have is a leader for our Center for Disease Control, who is a very experienced epidemiologist, and I'm not saying that because he's my friend. I think he's probably one of the handful of epidemiologists anywhere in the world that could run an outbreak management process at the scale that he is. Obviously, there are political challenges, there are resource challenges, and these are having an effect. At the moment, the 2 biggest cities, Lagos and Abuja, have gone into lockdown. And with that, there's a huge challenge of actually trying to do that in such a bustling metropolis as Lagos. The Lagos state government, who, I must commend for, again, some of what they've been able to do against very challenging circumstances, are really doing a reasonably good job in the circumstances, trying to mitigate some of the, distributing food items and providing welfare to people who won't be able to go to work. And so, yes, it's a tough situation. More help is needed in terms of resources, in terms of financing, in terms of support with, as I say, context-specific and appropriate contact tracing methods and social isolation methods, how you amplify the critical messages across the populations. Those are some of the areas that need support.
I'm interested in your point around sort of social distancing and trying to have anthropologists work on either different approaches to it or more appropriate approaches to it, or come up with different approaches, because obviously the virus has a certain R naught and a certain physics to the way it spreads. And you have contexts where people are particularly, in townships or shacks or informal settlements or slums, people live incredibly close to each other, and it's almost impossible / unrealistic to try and achieve this. Are there solutions? Is there any thinking happening on this, or is it just, you can't beat the physics of needing to be 2 meters apart?
That's a really interesting question, and one that has exercised me quite a bit, because when I read the criticisms that are very valid of WHO trying to roll out social distancing and in crowded communities, I'm thinking, I actually did quite a bit of Google searching because I wanted to try and come up with potential solutions for Nigeria, and I couldn't really find very much in terms of what people are doing and thinking. And I think I'm a natural optimist. I'll put my hand up on that. And I think that if people put their minds to it, and we're at a point in the world where we are able to tap into pools of innovation and people thinking differently, I think more people should be focusing on thinking, well, what can we actually do? And we saw this, with Ebola in Liberia, which was one of the first places that EpiAfric worked in when we started as a consulting firm. And, we saw, for instance, being able to use localized infection control practices and processes that, took into account the reality of, so having every home have a bucket of water with disinfectant at the door, having the hospitals use those sorts of methods. I want to see more people thinking about that as well.
In South Africa, at least, and I'm sure this is true, across the continent, one of the kind of pinch points has been when people, particularly people who live in informal settlements, have to go out and get food. Yeah. Because you don't live in a house. Sometimes you don't even have a refrigerator. On a daily basis, you're going to have to go and get and obtain food. And when people are concerned about food running out or stockpiling, people go converge on places to get food. And then you have this sort of very terrible difficulty of, needing to satisfy two basic human needs. You need to get fed and you need to make sure that you don't get infected. And the policing of food distribution or food purchase places, just shops, has become a real flashpoint where you've seen some really bad practices of people being tear gassed or shot at, rubber bullets, being told to socially distance when you have a 65-year-old grandmother who's just trying to go and buy some food. So is there any work that's being done on how to kind of ease the choke points around food distribution in these contexts? It seems that would be a very beneficial thing to try and get right.
Yes, it would. And like I point out, in Nigeria, Lagos state government is trying to do some of that. We've also seen some horrific videos there of the Nigeria police being fairly brutal, but we've also seen some wonderful videos. There's one about where the police go to shut down a Pentecostal church service, and the guy shutting it down uses the Bible verses, that say you should obey the law to the priest, and he meekly accepts that he should shut down. And I think actually that holds the key to some of these challenges. We saw it with Ebola. You've got to involve the people in designing and thinking about these decisions and what can be done, and not treat them as an outside. You've got to get the community involved in thinking about it, and they themselves owning those solutions.
We have one of our members asked a question around testing, which is, are there seems to be two useful applications of testing. One is potentially in triage situations. So question, is that a useful moment of being able to sort of say, well, this person clearly has COVID and therefore consequence A, B, and C? Or two, trying to identify people who might be or have been super spreaders who, you can try and take some ameliorating measures. Given your point about, in the absence of testing, if you have symptoms, I mean, we should all, whether we test it or not, practice good, all the things that we're supposed to be doing in order to limit the spread. But might those be two instances where testing can be extraordinarily helpful?
To be honest, in relation to triage, I don't see, because the management of a patient with coronavirus infection, when it's mild or moderate, which is when you want to triage, because if they are breathless, you don't need triage. They are obviously in extremis. The management is no different. There's no treatment for it. So it's self-isolate, analgesics, fluids, and stay away from other people. So I don't see triage as, I see health workers being tested as a potential target group, because that helps in spreading your resource. And the other bit also about targeted testing in terms of, I think that's where you want to target the testing, combining things like the lockdown. You then need to think very carefully, who are the people I want to test first? Who are the high risk people, and how do I target them? Yes, I think there's probably a place for that. But I think all that has to be looked at against the resources available and the effort. It's a question of marginal benefit and cost benefit as well. With limited resources, do you want to throw it all at trying to get tests that don't exist, using clinicians who are very, very stretched to deliver it, or do you want to sort of adopt a different approach? And that's where I think, if we could get that message out that everyone who has symptoms, just assume you have COVID and behave accordingly, I think that would be, a much cheaper and possibly more effective way, pending the arrival of more tests and more testing kits.
So maybe it is just your natural optimism that I'm picking up on, and maybe there are some, good reasons. I mean, we all know that the demographics of the African continent are, the youth bulge is something that we've spoken about through the continent already. And there may be an irony that youth bulge, will be a great gift to the continent at this particular moment, as compared with a place like China, where the demographic distribution is quite different, and certainly in the West, and that you've seen it rip through Italy, and particularly tragically cut short the lives of so many elderly people. So are there other reasons? I have been have this sort of sick feeling in my stomach for the last couple of weeks, just thinking about, it from a South African perspective, but are there reasons to be cautiously optimistic about its impact on the continent, or is that too strong a statement?
I would say the numbers suggest that there is, or that there are reasons for it. The demographics. So if you like, the theory suggests that there may be reasons for optimism. I think given how new the virus is and how, we're still learning a lot about it, it would be incredibly unwise to be complacent in that way. It's something to certainly look at as it develops, but we cannot take those chances, especially given how fragile our health systems are, in terms of being able to cope. I mean, we've seen the NHS being able to roll out all sorts of things in terms of additional capacity. Most African countries don't have anywhere near that ability. And so trying to sort of do the prevention bit is actually incredibly important.
Well, Ike, I'm very grateful. We've come to the end of our allotted time. I'm grateful that you have availed yourself this morning. Particularly, this must be a wildly busy time for a person who's on the front lines of this. So thank you very much. I look forward to continuing the conversation, and I completely agree with you that even if there is a hidden demographic blessing, in the continent, I think getting on the front foot of prevention and taking all available measures to stop the spread is absolutely essential. So stay well and stay safe. Thank you everybody else for listening in, and hope to see you in person soon, not just on Zoom.
Thank you very much, Paul. And I'd just like to add that there's a role for everybody to play in this.
Thank you.